Welcome to the Toronto Cardiac Tumor Conference for 2021. This year, we're concentrating on tumors that invade the heart. This year marks the 6th annual conference. The conference continues to add content as an online resource with lectures for patients and physicians alike in dealing with problems of tumors that affect the heart. Each year has a focus on a different topic, and it's a continuing growing virtual textbook for patients and physicians on these topics. We've become accustomed to online meetings as COVID-19 has reached pandemic proportions in our world, and this has come to the Toronto Cardiac Tumor Conference. Although the meeting is online, there's time for questions, and we encourage questions to be sent to us so that we can ask the speakers. It is webcast again this year on YouTube and Facebook, with subsequent uploading of all the lectures onto the Toronto Cardiac Tumor website. There's a lot to be thankful for. We've enjoyed endorsements for so many years from Ontario Health, the Society of Thoracic Surgeons, and the Peter Munk Cardiac Centre. I have to thank again the speakers and the attendees for making the meeting what it is. Elena Morozova has helped us in the past few years with the flyer. Anybody who's put together a meeting knows that although we have the ideas, it is somebody behind the scenes who makes the meeting possible. Danu Sabason is my personal, professional, and conference assistant, and many thanks go to her. Of course, Henry and Barbara Bank are the real reasons behind the meeting. Through their generosity, we've been able to have this meeting over the past 6 years, and hopefully we'll continue to have it over the next many years. Now, the problem with cardiac tumors is that they are very rare. They're so rare that physicians may never have seen a cardiac tumor, and they don't know where to go to when they have a patient. Because it affects the heart, they usually send it to a surgeon, but the surgeon may never have seen a problem either. So if the physicians don't know what to do, and the surgeons don't know where to go, where's the patient to turn when diagnosed? That's what the Toronto Cardiac Tumor Conference is all about. The vision of the tumor conference in general is to improve the care of people with cardiac tumors around the world. The mission is to develop a subspecialty of cardiac tumor care which presently doesn't exist, and to develop a global network of centers of excellence in the diagnosis, treatment, and care of patients with cardiac tumors. Last year, we introduced a cardiac tumor database. This year, there will be an update about that. So the conference is always targeted primary cardiac tumors. Here we see a primary cardiac tumor, one that's likely inoperable at this time. We don't know the tissue diagnosis, and that creates a problem. If this is a malignancy, which is likely so given the fact that there's invasion into the pulmonary artery, chemotherapy will have to be administered. The hope is that this chemotherapy will reduce the size of the tumor so that it will become resectable. The problem is trying to figure out what type of tumor this is. Clearly, different types of cancer require different types of chemotherapy. And in order to find out what chemotherapy to give, we need to find out what this is. When a tumor is within the lumen of the heart, or within the lumen of the blood vessels feeding the heart, we can rely on a transcutaneous, transvenous puncture and biopsy in order to get a piece of the tumor. There are still some problems with small volume tumor diagnosis, and that's going to be addressed in this meeting as well. If you have a person like Patrick Wogala who's going to speak to us today, you also have an option of getting a percutaneous, transcutaneous biopsy of the lesion. This is something that I had never even thought was possible with the tumor primarily involving the heart, but has become possible through the efforts of Patrick Wogala and his team in our radiological department. This year, however, we're also going to concentrate on tumors that invade the heart. Here's a lung cancer that's invading the left atrium, and that is going to be a primary focus of our talks this year, in addition to the ones that I've just spoken about. Tumors can invade primarily into the heart from adjacent structures, or more commonly can invade through the veins and arteries that access and enter the heart. This is a typical tumor. It's a renal cell carcinoma, a very large tumor of the kidney. And as you can see, the tumor has grown into the renal vein and up the inferior vena cava and entered the heart. Interestingly, when the renal cell carcinoma enters the heart, it becomes very smooth walled. This is regardless of the size of the tumor thrombus, so to speak. We'll hear more about this later, but here's obviously a much larger tumor within the inferior vena cava. However, when it hits the heart, it becomes very smooth walled. Other tumors, as they enter the atrium, expand to fill the space that they occupy. This is an example of a sarcoma growing through the inferior vena cava and into the right atrium. Obviously, this cannot be pulled back, but the heart has to be entered in order to allow resection. The tumor expansion occurs regardless of which blood vessel enters the heart. This is a sarcoma of the lung, which has entered the left atrium. And you can see that as it entered the atrium, it too is expanded to fill the atrium. So the objectives of this meeting: by the end of the conference, the participant will be able to describe the workup, pre, intra, and postoperative strategies in the treatment of tumors that secondarily affect the heart from other organs. The participant will be able to describe the technique of percutaneous biopsy of cardiac tumors and the challenges involved with chemotherapy when standard agents have been exhausted. In addition, they'll be able to understand and describe the problems of biopsy diagnosis with small volume tissue. The goal of the conference is to explore the current state of knowledge and treatment and strategies for tumors that invade or involve the heart secondarily. The faculty this year is made up of a number of individuals. You can see them listed here. We have a combination this year of staff and trainees, as has been suggested in previous years, helping us with this conference. So without further ado, let's start the conference with the first presentation. And I hope you enjoyed and submit questions so that we can ask our speakers and find out more and learn more along the way. Thanks very much.